Anne-Marie Morrow. I have the pleasure of being your president at ENRS. And today, we would like to thank our annual partners who are sponsoring us and throughout the year. And NYU Rory Myers College of Nursing, UConn, Boston College, Adelphi, Columbia, Pittsburgh, Northeastern, Rutgers School of Nursing, Rutgers School of Nursing Camden, the Heilbronn Family Center for Research in Nursing at Rockefeller University, UMass Boston, Mass General Munn Center for Nursing Research, and the Dana-Farber Cancer Institute at the Phyllis F. Cantor Center for Research, and also Jefferson. Some housekeeping. We would like to remind you that all attendees are remaining on mute throughout the presentation. So please enter all of your questions into the Q&A box throughout the presentation, and then I will help pose them to our guest speaker. If you are having technical difficulties, you can enter those into the chat box. So it is my extreme pleasure to introduce our presenter, Dr. Suzanne Miyamoto. Dr. Miyamoto is the Chief Executive Officer for the American Academy of Nursing. As you know, the Academy's mission is to serve the public and the nursing profession by advancing health policy, practice, and science through organizational excellence and effective nursing leadership. With nearly 2 decades of policy, advocacy, and leadership experience, Dr. Miyamoto directs the internal operations to help the organization achieve its mission, vision, and strategic plan. Dr. Miyamoto is highly regarded for her expertise in healthcare and educational policy, as well as her leadership and successful development of advocacy-based coalitions. Prior to her position at the Academy, Dr. Miyamoto served as the American Association of Colleges of Nursing's Chief Policy Officer. She is a member of the editorial board for the journal Policy, Politics, and Nursing Practice, and the National Minority Quality Forum's Advisory Board. Dr. Miyamoto is the host and executive producer of Inside the Bubble, a health policy podcast. She has previously held roles at the state and federal level with the National Institutes of Health, the Commission on Patient Safety for Michigan Health and Safety Coalition, and Capitol Hill. Her research areas, publications, and presentations focus on health policy, coalition building, and political advocacy. Dr. Miyamoto is a fellow of the American Academy of Nursing, an honorary friend of the National Institute of Nursing Research, and a 2014 Robert Wood Johnson Foundation Executive Nurse Fellow. Please join me in giving a warm welcome to Dr. Suzanne Miyamoto.
Thank you, Dr. Moore. It's my pleasure to be here this afternoon, and I'm just delighted to have this opportunity to share with all of you some thoughts around what we think around the policy, the politics, and kind of what's happening right now in the nation, because now more than ever, science is desperately needed, as you all know so acutely from whatever position you're sitting in. So I just wanted to take a moment and again thank ENRS for this wonderful opportunity to be here and share some thoughts in this area. One of the things that I think is so critically important as we think about all of these different pieces is they are so intertwined. And we sometimes get in our rules around, well, I'm a nurse scientist, or I am a nurse, or I work in healthcare policy, but it is really the reliance on each other to be able to have those conversations and move the needle forward. But before I do that, I wanted to say Happy International Nurses Day on behalf of the American Academy of Nursing. We are just really inspired this year, more so and just as critically as ever, as all of our nurses across the globe are facing really the challenges that come with COVID-19 and the coronavirus pandemic. And it is so hard to think about just the sacrifices that are being made, but at the same time, all the innovation, all of the true grit that comes with the courageous efforts of all of our frontline providers, including our nurses, and that includes our scientists as well. We know that nurse researchers are out there looking at how this is impacting the communities, looking at how this is impacting individuals, and we need to move, as I said earlier, that needle forward, and science, policy, and politics are all part of that process. So happy International Nurses Day. As I mentioned, it really is foundational. Science is foundational to this work. We talk about it all the time, evidence-based policy, right? I remember in undergraduate studying policy and knowing that this is where I wanted to be one day, thinking through how can we get that voice of the profession into these larger policy conversations, into these larger contextual discussions around what is shaping the laws. And it's a really interesting time to be thinking about, is science foundational? No matter what channel you watch, no matter what news outlet you're watching or listening to or reading, there is this interesting dynamic of what is the politician saying versus what is the scientist saying, and how do we mesh together what policy is grounded in, what the politics are saying, and what our science is saying and what we need to do. And with this new virus that it seems like every day something is changing and new information is arising, how do we keep pace with that, and how do we create policy fast enough to address some of these challenges and these changes that the virus is creating? But we know, as those of you that are in the room today and listening to this conversation and listening to the conversation later, we know that to do that, we have to look at the best evidence that we have at the time. And for us at the American Academy of Nursing, this is really central in why we are so invested and in great partnership with the Council for the Advancement of Nursing Science. As you know, many of you may be familiar with through your work with ENRS, the Council for the Advancement of Nursing Science started back in 2000, and really with this mission of better health through nursing science. And it was just this year, as the council celebrated its 20th anniversary, that we had this opportunity to think through how can that partnership of policy and science have that a true alignment so that we can move both agendas and both work forward. So I have the distinct and wonderful opportunity to work with your president, who serves on the CAN's leadership, the National Advisory Council, to be able to think through how things are being impacted in the different research societies. This is also a partnership with the NIH, specifically NINR, as well as Sigma, and really thinking through the different science entities. The American Nurses Foundation is also represented there. The leadership of Nancy Redeker and Susan Rawls as the chair and vice chair has been really critical to be thinking through at this time, what is that voice that we're bringing to the table? And as we were thinking about the Academy's responses to COVID-19, we also can rely on the information that we know CANS can bring. And we'll talk a little bit about what that looks like from funding perspectives, from what is happening to the science portfolios as dollars are shifting to COVID-19 research or other entities. So it really is this wonderful partnership to be able to bridge both worlds and move an agenda forward together collectively. And if you aren't a member of the CANS, I would highly recommend taking a look at what that opportunity may look like for you to help contribute to this larger voice at the national level for nursing science. So the conversation today is really going to think about these pieces of the science, of the policy and politics, and then the framing. And framing is so critically important. But as we think about science right now, and we think about looking at it through the context of COVID-19 and the coronavirus, there's so many different aspects that we know researchers around the globe are looking at. They're racing to find a vaccine. They're racing to look at better treatment methods and interventions. You may have seen, if you're an Academy member, we're also sending it to all of our CANS members, the Academy's COVID Digest. And we featured in there some of the work that Dr. Bernice Coleman is doing at Cedars-Sinai, looking at different ways of prone positioning to help those that are on ventilators. So we know that nurse innovation is happening, nurse research is occurring right now at the bedside in real time. And we know that nurse scientists are serving in these roles across the country and around the globe. So when we think about all of these different aspects, we know there's also science occurring and looking at what's happening with the underserved and those disparities and health inequities that are coming to the forefront as we keep seeing occurring in the news right now. So when we think about some of those pieces, here, for example, the research that's being done just to look at those health inequities, the Kaiser Family Foundation took a look at when we think about the different populations of who's being most affected or have serious high risk of serious illness if they are infected with the coronavirus. And you see these disparities coming out in that research. We have to be thinking through what are the methodologies, what are the treatments, what are those different pieces to help address these inequities. Because as we consider even the next wave, the second wave, as we are all predicting, where will we see those pockets and those areas of the country that will be impacted even further, and what do we know now to put that into perspective? We see this again, just another example of how the serious illness is impacting by household income. So all of these different aspects of looking at the data are really important to inform what those policy decisions are. And, when we think about the testing aspect here, again, just looking at the data, Kaiser Family Foundation, if you don't use that resource, is really incredible just because of so many years and decades of doing polling and looking at different cross sections of data, where each state stands on coronavirus testing. Just this week, it was put out on the 5th, and how much testing is occurring. And you hear that time and time again. I mean, right now, as you probably all know, or have been, if you are like me and have those alerts on your phone, although I've shut them off for this presentation, you see, the hearings that are occurring with the top scientists here in the United States around what's happening with the coronavirus, and hearing those testimonies right now in Congress to better get an understanding of what comes out of that next coronavirus package, that next stimulus package. And as we think about that next stimulus package, it's really important that we reinforce the policy aspect and the research aspect in making that policy. So thinking about the policy, knowing that there's so much to study, knowing that there's so many different aspects that have started to come forward because of the coronavirus and all of the different aspects that it's addressing, we also have to think about what are those major policy initiatives. And the Academy took that on, it was very early in March, when we knew that a lot of this work and the coronavirus was going to impact communities globally. As we saw things coming out of China, out of Italy, we needed to have a sense of where was it that the Academy was going to help support. And through that work, the board of directors really put in 3 priorities that we wanted to focus on related to the coronavirus. And as we thought about all of the different nursing organizations across the country, as you probably know, there's over 100 national nursing organizations from so many different specialties, from so many different subspecialties. We just really have a robust response. And the Academy thought through what was that unique voice that we could bring to the table table to help bolster what other nursing organizations, other healthcare organizations were saying in partnership. And where the board landed was these 3 areas focusing on vulnerable populations. One of the big concerns that you all know early on with the coronavirus was what was happening in the long-term care facilities. And those that were in close quarters, those that were in congested living facilities, we think about homeless shelters, we think about the prisons, all of those areas. How are we going to make sure they have the proper testing, the employees that are taking care of these patients have the proper protective gear? The next piece, so critical to the work of the coronavirus, is really supporting nurses and healthcare providers. And it was more than just PPE. Many of us know that in the early, I have to be honest, it feels like days turn into months, turn into weeks. It's the time concept is just really interesting as we move through this. When we think about early, it really only was about a month ago that we were talking about some of those big issues around PPE and testing. And those issues still are occurring. They're occurring in pockets across the country. But now, as everything starts to unfold, we start to see the issues around moral distress. We start to see the issues around looking at what are those aspects of care that can keep moving forward. So I think looking at the priorities, that was the next piece. So that increasing access, scale, speed, and accuracy of the testing was really quite important. So moving on to how then did we frame out these priorities, and really looking at it from where you all sit in the research world of what is the priority when we're talking about that next piece around research. What is the policy priorities? What were we asking for in stimulus funding in these research portfolios when it comes down to these large trillion-dollar packages that are coming out of Congress? And just last week, or on April 30th, so a little over a week ago, we sent a letter to the Senate and the House, really focusing in on what would be our funding requests. And we talked to a lot of stakeholders in the community. We talked to different research groups, for example, the Ad Hoc Group for Medical Research, which convenes different research associations across the country. And it looked at the funding. So from our perspective at the Academy and talking to all of these groups, it was all of those areas, basic, biomedical, behavioral, looking at both intramural and extramural, and that we really needed to ensure that research capacity was not interrupted during this critical time. All of these research funding that has been coming out of CDC, NIH, the Agency for Healthcare Quality and Research, all of these government funded grants, we have to keep those moving. There's so much that's occurring, and we can't have that distribution of current funding stopped. So that was another request that we included, is that we have to keep those research efforts pre-COVID still moving, because as we know, when we think about all of the different research that's occurring, it is hard to stop an entire portfolio and shift when we're coming up with new calls or new areas of focus. But one of the things that is so critical, and you would know that would come out of this, is that we do need more emergency supplemental funding in NIH and other research entities, but specifically for NIH, we went with the community request of $31 billion for emergency supplemental investments for NIH at this time. There is so many questions, and it's not questions just of today. What will be the impact in the future as we wait for that vaccine, as we are rushing to find that vaccine? So a lot of that is really important to be thinking about. So from the science perspective, from the policy perspective, how do we make sure research continues? So this is one of my favorite quotes as we think about science and policy and its interaction. Get your facts first, and then you can distort them as you please. And we often, kind of think through what is it that we really want to make the case for, and then how does the policy process, the politics of it, change what those statistics or facts say. So that's where we wanted to take a look at. There's so much, we could have an entire conversation on the policy of the coronavirus, of the politics of the coronavirus on research, but this is information that can really help further into conversations in the future. So when we think about the policy and politics, there are some basic core values. When we think about them, when we think democratic values, this is for both parties, essentially. And this work was done by Deborah Stone. She wrote a book a number of years ago and has updated it a few times, but it's called The Policy Paradox: The Art of Political Decision Making. And she talks about the fact that there are these democratic values of equity, efficiency, security, liberty, and community. Now, how you interpret based on your beliefs or your own personal values or your political party's values may differ slightly. But essentially, this is the core of how we shape policy in this country from Deborah Stone's research. And when we think about how do we then take those policy values and put them into the context of making decisions or moving a particular campaign or initiative, you probably are very familiar with this just based on the way that you conduct your research. We're looking at the target population of who the policy is going to affect. We're looking at the values of what that policy comes with, what community it's trying to impact, and why are we moving that forward. We're looking at the rules governing or constraining that action. Is it a federal level? Is it a state level policy that needs to be addressed? And we're looking at the rationale for it. So what is the evidence? And what we talk about in these four kind of overarching themes or assumptions around building policy is that they all logically tie together. And having spent a number of years advocating and working in policy and politics, sometimes all of those pieces don't necessarily translate, and it really takes strong communication and framing to make sure those move forward. So when we think about the presence of policy-making decisions, many years ago, over 70 years ago, Herbert Simon published this seminal work on understanding policy choices. And it really is an interesting dynamic when we think about, as a research community, we're making it based on the evidence. And what, his research looked at many years ago and has been studied since is that individuals are not necessarily rational actors. And one of the pieces of kind of that summarized this and took it on as another way of looking at it was, you may all recall that Ada Sue Hinshaw and Pat Grady, Dr. Hinshaw and Dr. Grady worked on a piece together a number of years ago looking at science, nursing science and policy decisions. And when do policymakers use science? When do policymakers not use science? And sometimes it's based on their beliefs or their values. So it's not always just looking at the evidence. Sometimes they believe something because of that's how they were raised or the values that they're shaped around that issue. The other piece to this is that individuals are limited by cognitive and environmental constraints. So how much do they know about the issue? How much have they been exposed to the issue? As we talk about healthcare in particular, it's hard for them to understand kind of some of those dynamics that are happening at the in the community, in healthcare at the bedside, because they're just not exposed to those environmental constraints or those areas where they know the most. And then we also know, as we think about these policy choices, that compromises are made by adapting to the situation. So as we think about this fifth stimulus package that is going to come forward on the coronavirus to address the demand and the impact. We know that House and Senate negotiations, depending on what is the view of the Senate majority of the Republicans and Mitch McConnell, and the House majority leadership of Nancy Pelosi, and where are those conversations going to meet, and what are those compromises that are going to be made. One of the recent conversations that just came out yesterday, an article in Politico, is Speaker Pelosi is really looking for mandatory paid leave to be represented for healthcare providers in this next stimulus package, where there are concerns on the other end around providing that that level or that much of paid leave if individuals or healthcare providers don't come back to work or take too much sick leave, and what will happen to the workforce. Will it diminish? So these compromises are going to be made to negotiate what is actually going to be in that final package. So thinking about these premises of what the decision-making policy is, there are what we talk about. There's Camera has this other fantastic book if you are kind of trying to understand how change happens or doesn't. And her title really looks at the politics of US public policy making. She describes there are 6 sectors for change. So we have these decisions that need to be made. We know that healthcare, that policymakers are bringing their own values, their own insights to those conversations. But she talks about, again, looking at it from a very scientific manner. But then it brings in these overlays of the politics, right? So looking at assessing change, if change is going to happen in the policy process, there are these 6 sectors. So it's the problem, it is the solution, who's offering, what is the current problem? Obviously, we know the laser focus is on the coronavirus and its impact. The solution, there are multiple solutions, and we have so many entities trying to engage in that discussion. So we have the inside players, we have the outside players. So we think about the inside players really are those that are having those conversations in the leadership conversations. And then we have those that are attempting to influence the situation, who are attempting to have their viewpoint of their constituencies brought to the table and lobby those decisions to be made. Very similar to the American Academy of Nursing. While we're not necessarily a lobbying body per se, we do weigh in on policies moving forward. You think about the American Nursing Association. The American Nursing Association is talking about mental health for providers and nurses. They're talking about making sure that there is enough testing for providers, that there is enough equipment for providers. So each of those are going to impact whether or not there's going to be change, and how loud are their voices. So then what are the strategy, the tactics, and the scope of the conflict? I think one of the issues that we're having is there are a lot of different pieces that come into play around who's advocating for what and who has that loudest voice. And this has always been the case when it comes to policy and advocacy and those pieces of politics. And one of the things that we can try, or the different strategies that we have, is looking at it from the perspective of partnerships, or moving forward with, for example, again, on some of the early advocacy, you saw that the American Nurses Association and AHA and AMA were all sending information together, letters together to Capitol Hill. Another sector of change, and we can't forget, I think sometimes we do, that there is going to be an election in 2020. We have an election coming up in November, and right now campaigns across the country are still trying to navigate, what does this mean for them? How are their communities impacted by the coronavirus? What they're considering in their votes as they look at how they're going to vote on the next coronavirus package, how they're going to take in information from their constituents based on what's happening real time in their districts. And I think that is a large impact factor when it comes to addressing those 6 sectors of change. So when we think about the premise of policy, my apologies, when we think about these struggles of ideas, when we think about all of these different aspects that we can pull in, Deborah Stone talks about that the policy process is really the struggle over ideas and who has the best solution, who has the best piece to move that particular issue forward. So what comes into play next is really, how then do we get the public? How then do we get the policymakers? How then do we make sure all of these pieces intersect and overlay to move a particular issue forward? And how issues are framed and the values that policymakers attribute to the issue really does impact their decisions and the public's understanding of them. We know that there is so much misinformation out there already as it relates to the coronavirus, as it relates to what may be happening next or where people are getting their information from. And there's so much just information in general. And one of the big things that we have to look at is, if we have a particular sector of how we want to, or a way that we want to impact the conversation, we really do have to think about that frame. So what's the science behind framing? How do we come up with what is the talking piece? What is that catchphrase? What is that motto that moves the policy forward? And one of the things that I think from a nursing perspective that we always kind of go back to and really have to think through consciously is that we are a trusted voice when it comes to including correct information. You know, nursing is one of the public's greatest defenses against misinformation, against fear, against viruses and disease. We are there in every sector and every community. And so thinking about, when we think about the healthcare system, you see that there was this study done last year by the Commonwealth Fund and the New York Times and Harvard, looking at Americans' values and beliefs about the national insurance reform, this one sector, and 58% really truly trusted the information coming from the nursing profession. We also know, as we think about the Gallup polls, how information is communicated, or that profession being the most honest and ethical. So when we say something, it is really important that our evidence is so grounded in what we are communicating to the public. One of my favorite kind of conversations around this, if you haven't read it, it is a good read. It's a little political, but it is a good read. It's called "Don't Think of an Elephant, Know Your Values and Frame the Debate." And what Lakoff really talks about is this concept of framing, and how does the public pick up on a particular piece of information? How do they know that this science or this evidence is what the solution should be? So when we think about the brain and all the circuits in a brain, and what he talks about is the language choices. What are those words that we use to describe our research? What are those ways that we talk about the impact that we're making? So the language choice, what we say, can increase or decrease the strength of those circuits. And this really plays out particularly in his work, and he talks about political campaigns and how things are framed in those campaigns to make the public want to move forward or want to support or rally around a particular cause. Another aspect of that is imagery that addresses the point of view can sometimes be stronger than that language. Over the last couple of years, you see them everywhere. You see the infographics, you see those short snapshots of what it means. You see the imagery around social distancing and what 6 feet looks like. People can quickly grasp your concept or your evidence through those images. And the frequency of those images and language really strengthens that point of view. How many times is it used in the media? How many times is it used in those social media channels that really continue to move the conversation forward and become part of the mainstream? And what he talks about in using these frames is that you have to repeat it until it becomes a part of the public discourse. I think maybe the public health nurses in the world and many of us in the nursing profession have probably heard of social distancing before, but not the public hadn't heard of that, right? What is social distancing? What does it mean? What is the science behind, well, you all can answer that question, but what is the science behind 6 feet? Why are we saying 6 feet? But that these concept of repeating that frame of social distancing, and I think even, you know, my children who are home know social distancing means I gotta stay apart from my friends. So it's that, how do we keep repeating that frame so that different ways and different publics and different communities can understand what that means? And as I was thinking about just the communication aspect of this concept and thinking through what are those next pieces that we have to be focusing in on, there was this really great article that came out from the Kaiser Family Foundation that looked at what we can learn about communicating around COVID, thinking through it from the perspective of what we learned during the HIV epidemic and crisis, and we think about HIV over the many years. And this article really looked at, from Kaiser's perspective, Kaiser Families Foundation's perspective, of all their polling over the years and all of the research they have done, just looking at it. And I think it's a really interesting way to kind of think through using our science and using our evidence. And one of the things that this article talks about is don't overlook the basics. And I think that will be an important piece and an important point as we continue with the coronavirus. And what this article talked about is, even as we thought about HIV, really looking at it, that we still need to know in COVID how it's transmitted. We don't know all of those aspects. We know that people are walking around that are asymptomatic. So we can't forget just the basics of the disease and the virus, and making sure that we understand and continue to research those aspects. So communicating about those basics, and we are continuing to do that. We're talking about the testing, we're talking about making sure that we're doing those public health measures like social distancing. So the basics cannot be lost in communication. We don't want to stop talking about washing your hands. We don't want to stop talking about some of those basics, that as people start to learn new information, we don't lose those aspects. Or as we start to reopen as a nation, we don't lose those basics. The other piece that was interesting is that focusing on normalizing and not moralizing was one of their key points. And I think this was going back to the conversation around framing and messaging, and how to make sure the public understands what that science and evidence is coming to the table, and then also informing the policymakers. Is that one of the lines that they included in this article was that effective messages empower. And it is truly important to think through those messages of normalizing the coronavirus, because this virus is with us for, still quite some time. People are really going to be thinking about how to engage, re-engage in society. What are those new norms as we look towards having a vaccine that can help us? But what is the normalizing around COVID? Thinking about it can be hard to assess the personal risk. So what is the individual's personal risk? Making sure they understand that and they know that. This was another great point, and clearly as we see it with the pandemic, is that asymptomatic people are a key audience. We want to be effectively communicating to that population with evidence that they can't relax their social distancing measures as the country reopens, because we still know that people may be asymptomatic. There is that higher risk out there. Thinking about the responsibility lies with everyone. How can we ensure that these conversations continue to move through all of the right channels? Looking at acknowledging disproportionate impact without further stigma. You've seen this different ways of looking at different communities impacted, and the stigma, for example, on Asian Americans, or as we think about what is happening in various communities around the disproportionate impact, and making sure that stigma isn't placed, and watching out for further unintentional impact and stigma that could occur. And I think that the other piece that is really important through all of this is don't message in a vacuum. And I think this is truly incumbent upon us as a profession, is that we may all know our language and our communication strategies as a nursing profession, but we have to expand and make sure that we understand our patients can appreciate and truly kind of comprehend the messages we're trying to share. And not that we're just communicating with each other and turning our attention to that public lens. One of the things that I often, remind my staff and remind myself when we're doing communication for the Academy is we have on our Twitter almost at 23,000 followers, 2,800 fellows within the Academy. So I know that there's a large portion of those individuals that more than likely are nurses, but others could potentially be in the public. So how do we frame our messages so that we're not just talking to ourselves and we can get that information out there to different channels? And I think this is one area where we have seen incredible work I have seen nurses really focusing in on their op-eds, sending into their local newspapers, making sure that the public are understanding what their concept and what they're bringing to the table from a perspective of the nursing lens. So making sure we're communicating outwardly. Looking ahead to the messages about living with COVID, and I think this is where nursing comes into play most critically. How are we supporting our communities, our patients, to make sure that we can move those issues forward and the education that they'll need? And then I think the remaining piece that is really important here, looking at it from the perspective of connecting to resources. Nursing science, nursing evidence has to get out there. Which organizations can help further that message? I know that probably many of the attendees that are on this call right now are part of different organizations. They're part of different areas across the country. So I think that is a really important piece to be thinking about the global networks that they're in. How do we use our resources, our networks, to make sure our messages are further in the community? So as I think about kind of just the overarching concepts around the policy, the science, the evidence, the politics, they're so interwoven. And I think that in all of the years that I've been doing this, I can give you a number of examples of where I've gone into a member of Congress's office and had to sit through and talk to them about basics, right? I remember one conversation with a congressional staffer in which we spent about 20 minutes just going over educational styles within the nursing profession, and then getting to the larger contextual issue around practice. And I think that there are just these pieces that, because of the frame that they hold or because of the values that they hold, they're going to interpret your science or your evidence differently. And so thinking through how to message that has really been a staying point for my work as both a lobbyist, as a strategist, slightly different role at the Academy. But it really is important to be thinking through all of those aspects and taking your research and translating it forward. So one of the quotes that I often like from Albert Einstein's around all of this is, you can't solve the problem on the same level that it was created. You have to rise above it to the next level. And I think when we have this devastating pandemic that is just changing so many aspects about the way that we're delivering healthcare, about how we will deliver healthcare in the future, I cannot think of a more opportune time for our profession to really rise above to the next level, because we do have the solutions. One of the things that I reflect upon around the nursing profession so critically is that we are a profession driven by our science and by our evidence. But one of the prevailing messages and lessons that we all know is that to truly improve the human condition, we also have to focus on the human connection. And we see this in how nurses are looking at each other through their protective gear. It's that one look, it's that one smile, We know it when the healthcare provider, the nurses in the ICU, and they are in the room with a patient as they're passing, and it's only that nurse that's holding the hand. And it's that human connection that is going to be challenged as the pandemic continues. And I think nursing has those solutions. So as telehealth continues to evolve and move forward, it's going to be nursing ingenuity that thinks through how to maintain human connection so that isolation, those feelings of isolations, are overcome. I do think that this is our time to use our evidence, use our science, and move that forward. I really have always kind of liked this quote because it summarizes so eloquently just the situation that we're in right now, the challenges that we face over countless generations. You must never think so much as whether you like it or not, whether it is bearable or not. You must never think of anything except the need and how to meet it. And I think that is where our science and our evidence comes into play in advancing policy, because we are looking at, we know what's happening on the ground. We know what our research is telling us. It is then taking it to those individuals that can put it into play. But putting it into play means framing it in the way that they will understand it and put it into action. So with that, I know that we wanted to leave some of the time open for questions. I think that there has been some coming through. So I'm gonna stop sharing my screen and turn it back over to Dr. Morrow to see if what questions may have spurred from the conversation so far.
Thank you, Dr. Miyamoto, and thank you for this very stimulating and informative presentation. And certainly we do have a number of comments and questions in the chat, so I'll try to frame these for you. The first question was related to to nursing education and its relations to science, as in terms of can you connect nursing science to nursing education and policy and practice, particularly in this COVID pandemic?
Well, you know, I think it's a great question, and there's a lot of aspects to that. Working at, you know, the American Association of Colleges of Nursing for a number of years, there really is this, you know, nursing education is so incredibly critical to driving science, driving evidence, encouraging individuals to go and further expand upon their evidence and build that evidence. We know that there's a shortage, or not a shortage, we know that we need to bolster the number of nurses that are entering into the research track, the PhD area and focus. And I think as we look at nursing education, I think it is a great opportunity to think through how different schools and universities and colleges are going to take what they know or what they're seeing in the community to bolster that work. So as I think about, you know, one of the scenarios that I think back on while I was at AACN, we got a lot of questions from members of Congress when Ebola was occurring, and how are you going to change the nursing education programs to respond to Ebola? How are you going to change, and more recently with the opioid epidemic, we got members of Congress who were saying, well, you need to teach nurses more about the opioid epidemic. And so often we would get that the educational program has to change. And it's not necessarily the educational program has to change, it's just how do we incorporate that information into the framework of what we're offering, and how does that make sure that information is so critically available, and having the students understand it from the perspective of real time. So for example, with the opioid epidemic, how do we ensure that we can offer clinical opportunities? And I think this is a challenge too for universities right now, thinking about nursing education in COVID. And we know that when can they enter the healthcare system effectively? When can they get that experience and that exposure? There's so many different aspects of that that come into play, particularly as it relates to policy. Now, I focus really on the federal policy, but then there's this whole other aspect of the institutional policy. What does the AACN Essential say about this? What, does the broader concept impact it?
Mm-hmm. And I think, just as a very brief follow-up so we can get to other questions, the person was looking about science and evidence for nursing education. So for instance, tying the evidence to patient outcomes, because a lot of times, in my experience on the Hill, the lawmakers don't make the connection between education and practice. So how can we use science in that manner?
Absolutely.
So we have another question. What advice can you give on how to advance the policy of supporting family caregivers of those in long-term care? So how can we frame policy change to address these stakeholders?
That is an absolutely great question. And I think that family caregivers are a population on so many levels. AARP has been a champion on many of these areas. As we think about family caregivers, we're thinking about, there's so many aspects of it. One of the things that was an early discussion point was around nurses and other healthcare providers who are family caregivers for both their children and for the elderly. We think about those that are in healthcare facilities where they can't, long-term care facilities where those that family caregivers that have supported or provided additional care, how do we make sure they have the resources that they need? And I think this is where nursing comes into play around the educational piece. One of the things about helping them understand family caregivers is that, from my lens, there is probably a segment of the population within the policymakers that think about family caregiving as a responsibility, a duty. And you really have to frame it around the complexity of what may be presenting with these what these individuals may be experiencing in the home. It's not, there's so many more aspects now, both on the child side or on the older adult side with their multiple comorbidities. So helping them to frame the complexity of it, it's not just mom is at home with us. Mom is at home with us and we're managing multiple medications. They need to understand that piece of it. And just as you said, Anne-Marie, that piece around framing it from the perspective of the evidence impacts patient outcomes, to reinforce that family caregivers, if they have the right information, if they have the right resources and support, that family caregiver is going to have or that family member is going to have a better outcome.
Absolutely, absolutely. And these stories are really powerful when you're making that case. We have another great comment and question. So can you tell us how you would form an argument for improving professional practice in long-term care, where RNs are often seen as interchangeable with LPNs and where directors of nursing are not certified? So we know there is a link between education, certification, and the resident outcomes.
Absolutely. And, I remember a number of years ago, having some of these conversations around long-term care facilities and what are the regulations around them. And, I remember back in nursing school, spending a summer in an assisted care living facility and having one nurse. I mean, there's just so many different aspects of regulation. So what you're talking about is really looking at those regulations and those supporting some of the policies that are around making sure they're staffed well. And I think this pandemic has really shined a light on long-term care facilities and how much true support and evidence they need. The long-term care facilities were so overwhelmed with the number of patients that they received, that they had, and the staff that were there. I think one of the aspects about this is, probably if I went up to the Hill today, we would still, if we were asked the question, tell me what a nurse does, you would get 8 million different definitions or 8 million descriptions of what it is. So it really is hard for the policymaker to understand necessarily the LPN versus the RN. And that's not necessarily probably where I'd focus the argument of, LPN versus RM. I would focus it on professional nursing from the perspective of what is it that we know registered nurses offer, or individuals with nurses with more background or experience may offer the situation, because the staffing is going to be really difficult. And I think that it is, again, going back to the outcomes and presenting the outcomes around what is the impact of having a higher staffing ratio of nurses that are on the unit that can support the case. So it is, sometimes we get caught up in our own semantics of, you know, what are the different degree levels or different responsibilities or functions. But if you can take it and frame it from the outcomes perspective of what that, give them the example and then move it forward with, this is what professional RNs do, or this is what we do, because that is the staffing changes that need to occur.
And that's great. And so that's great advice. Can you take that another level then to advanced practice nurses and what they do, and knowing, you know, the CMS changes now, given the pandemic, how can we leverage that to expand the scope of practice for advanced practice nurses and communicate clearly what the difference is between professional entry-level nurses, what advanced practice nurses do versus physicians or physician's assistants, and how we can use science to make that link?
Yeah, absolutely. You know, that is a great question. And over so many years, you know, going back to this concept of framing, you know, we have learned so much about how to talk about advanced practice registered nurses, and look at it from the perspective of just that piece around, we don't want to say that they have independent practice, because that triggers that, no, they want to work on their own and they don't want to work in a team. So the messaging and the language that we use around advanced practice is really important. And you're absolutely right. CMS has really broken through so many of the barriers that have been put in place. We see states changing their scopes because of the pandemic. But what I have seen time and time again, and what I think was probably, and I always tell my students, your most compelling argument too is the evidence, but also looking at it, if you're framing it from another lens, it's the FTC, it's that anti-competition, it's so much of that has already been there. But I can't reinforce enough, it is the outcomes. It is, what has this nurse practitioner population done to change X? We do ourselves a disservice trying to get into the politics of even talking about the other professions or the other disciplines. We really need to be focusing on what we bring to the table.
That's wonderful. And we just have a couple of minutes left. There was another comment earlier when you talk about framing the problem, and how even with this, the same set of facts or evidence, there may be different points of view on that. So how can we come together around that in terms of framing the evidence in a way that's, I don't want to say apolitical, but not inflammatory in this political environment, and really use it in a positive way to move forward?
Mm-hmm. Oh, that is such a great question, because, you know, as individuals, just as you know, we think about, you know, we are individuals and we come with our values and we come with our beliefs, and it is so hard to take that out of it. But I think, you know, going back to what was discussed in just that Kaiser Family Foundation is really using, it's the basics, right? It's using what we want communicated most, right? If we are talking about you know, the public health infrastructure, it's talking about the role that, you know, nurses are going to be play in contact tracing, and even saying contact tracing, people may not know what that is. So it's boiling it down to a frame that people can understand. People can understand wash your hands. People can understand these very basic things. So, you know, it's interesting. You know, we just say support nurses, right? We support research. And sometimes we say support science over research because people understand science more. You know, it's all these different ways of framing it. And honestly, this is where I think it is a marriage between experts who are both the expert in the discipline, but expert in communication. RWJF just hosted this webinar last week. I'm happy to send it to the ERNRS staff. And they talked about about this. They talked about the communication strategies to make the public understand, and it's drilling it down to the basics and trying not to marginalize any one population. And then as it comes together across nursing organizations, I'm seeing it. I'm seeing that we're building upon each other. So I think we are getting in a good stride. While there may be a different aspect or lens to it, we are seeing that consistency around messaging.
Well, Dr. Miyamoto, I think that's the perfect summary to end this presentation. And it's been such a great dialogue and so informative. I want to let our attendees know that the presentation is being recorded and it will be posted on our ENRS website. And I want to take this opportunity to thank you, Dr. Miyamoto, for this wonderful presentation and for sharing it with us today. I also would like to remind everyone, and I'm going to share a little reminder for our next webinar. We are having webinar series pretty much monthly now. And our June webinar will be almost everything you need to know, but we're afraid to ask about research with LGBTQ+ populations. It will be on June 4th, 2020 at 11 a.m. And it will be sponsored by Jordan Boss from Dr. Jordan Boss from our ENRS LGBTQIA Health and Health Disparities Rig, Kristen Clark, a PhD candidate at the UCSF School of Nursing, and Dr. Casey Jackman, also a co-chair of our ENRS LGBTQIA Health and Health Disparities Rig. We thank you so much for your attendance today. Please stay safe and be well. See you soon.
Thank you.
Thank you.